Good morning, afternoon, evening, everyone. Thank you for joining me today. My name is Yali Zhang. So for today's presentation, I will walk you through some of the most common challenges we face when working with liquid suspensions, particularly those who involve colloidal avicel. So, all right, here's what we will cover under this presentation. First, we will look at the benefits of liquid suspension, especially when it comes to making things easier and more pleasant for patients. Then we will get into how colloidal avicel works as a suspending aid and how it compares to other options out there. Finally, we will use case study to demonstrate the solutions for challenging formulations like dealing with low pH or high salt content suspension formulations. So why suspension? First, suspensions are just easier to take and convenient. Second, for people who have trouble swallowing pills, liquid suspensions are actually a game changer. With the right formulation, suspensions can taste better and with improved organoleptic properties, which is a big win for compliance. And finally, a smooth, uniform suspension appearance really creates a better experience for patients. Excipients are essential components in liquid formulations. Their role extends beyond basic functionality. For example, they contribute to formulation stability, help achieve the desired viscosity and probability for accurate dosing, and also enhance mouthfeel to improve overall patient acceptability. These attributes are critical to ensure compliance and therapeutic success. So in a typical suspension, it contains API, suspending agent, dispersant, and protector colloidal, sweeteners, viscosifier, preservative, buffer, sequestrant, flavor, color, water, etc. So each ingredient serves a specific function to ensure the formulation is effective, stable, and acceptable to patients. Beyond the active drug, we rely on excipients such as suspending agents to maintain uniformity, protective colloidal, and the viscosifiers both serve to contribute to physical stability of the suspension. And then sweeteners, flavors, colors enhance palatability and appearance, which are also important for patient compliance. And then there's the preservative buffer sequestrant. These help maintain chemical stability and shelf life. So altogether, these ingredients form a carefully balanced system, which tailored to therapeutic and patient needs. So in this presentation, we will focus on the use of colloidal avicel as a suspending agent. Colloidal avicel is a co-processed excipient composed of microcrystalline cellulose and carboxymethylcellulose sodium. It is also referred to as avicel CMCC. It is widely recognized for its strong suspending capability and is comply with major pharmacopoeia like NF, European, and Japanese pharmacopoeia. In addition, it meets like a kosher and halal certification standards. And it's manufactured under GMP condition, use non-GMO raw materials. So these attributes make it a reliable and a versatile choice for formulators, like looking for both performance and regulatory assurance. Now let's see what are the critical material attributes that make colloidal avicel an ideal suspending agent for liquid suspensions that requires both easy of use and robust shelf life performance. The schematic drawing here highlights the rheologic behavior and functional advantages of colloidal avicel as a suspending agent. So when properly dispersed or activated, colloidal avicel forms a gel-like network that stabilizes undissolved particles. and minimize sedimentation during storage, providing like strong suspending capability. Under shear, like for example shaking, the gel-like structure breaks down quickly, and then the system exhibit shear thinning properties, which allow like for smooth pouring or administration. Once the shear is removed, the gel-like network gradually rebuild, showing a time-dependent recovery, which is a key indicator of sextropy properties. So sextropy property is ideal for suspension, as it offers a unique combination of stability during storage and the ease of use during like application. So a rheometer is commonly used to characterize the functionality of suspension. For example, a suspension sample is placed between two plates, one stationary and one rotating plate. The rheometer applies a range of shear rates to simulate like conditions like shaking, pour, or stirring. As the shear rate increase, the rheometer records the shear stress required to deform the sample, right, the liquid sample. In a six-tropy material like Colloidal Avicel, the shear stress initially increase, which means the gel-like network structure like resist flow, then decrease as the internal gel-like network breaks down. Then when the shear rate is decreased, the rheometer tracks how the material rebuild its structure. The difference between the upward and the downward curve, also called like hysteresis loop, reflects the time-dependent recovery and energy loss, which is a key indicator of sextropy property. There are two Colloidal Avicel grades commonly used in farm suspensions offered by Rocket. They are Avicel RC591 and the Avicel CL611. They both widely used in oral suspensions and nasal sprays. The recommended use level for Avicel RC591 is 1.2 to 1.5% as a starting point. For Avicel CL611, the starting point is 2.4 or 2.6%. In addition, like Avicel CL611 are also used in reconstitutable suspensions. The typical use level is around 4% or above. The proper activation of Colloidal Avicel is very important for its suspending functionality. For both grades, the process begins by like dispersing the selected Colloidal Avicel into DI water. Then the Avicel RC591 requires high shear mixing to fully activate its gel forming property. The higher shear mixer with a stator, a rotor type of homogenizer like a Silverson Ultra Terex is recommended. Ideally, an inline high shear mixer is preferred because it's easier to scale up. Avicel CL611 can be activated under low shear condition, making it more flexible for manufacture, like it doesn't have high shear capability. This slide demonstrates the importance of activation on the functionality of Colloidal Avicel, which is critical to the suspension performance and stability. Both dispersions were initially mixed at the 800 RPM for 30 minutes. Then dispersion 2 was subject to additional high shear homogenization. So for dispersion 1, without proper activation of dispersion, you can see the suspension shows like undispersed aggregates of MCC, means like poor activation and the inconsistent particle distribution. For dispersion 2, with proper activation, the suspension shows uniformly dispersed MCC particles. Then this video contains samples on microscope slides that are slightly moved to show how the suspensions respond to the shear. So under shear, you can see suspension 1 shows the aggregate domains that stay in place while the second phase move around the aggregates. So it's not a stable dispersion. For dispersion 2, it shows a single movement in one direction under shear, which demonstrates a gel-like network, very effective activation. It will be a stable dispersion. In the next few slides, we will use some case studies to show how to solve formulation challenges in suspension formulations. As we know, selecting the right suspending agent is critical for a successful suspension development. So in case study 1, a model formulation is used to demonstrate the superior suspending capability of Colloidal Avicel relative to other commonly used suspending aid. Then in case study 2 and 3, we will address formulation strategies for managing like low pH and high salt environments, which are very commonly seen in suspension formulations. In this case study, different suspending agents were evaluated in an APAP model suspension formulation, including Colloidal Avicel grades RC591 and Cl611, as well as alternative chemistry like xanthan gum and sodium CMC. So the table here details the composition of each formulation. Each suspending agent was used at their optimum use level. The pH of the formulations is around 6.5 to 7. All suspensions were characterized in terms of their rheologic properties initially and also during storage. The stability of the suspensions were monitored by turboscan. All suspensions were stored under room temperature for their stability evaluation up to 1 month. So this slide shows the sextropic behavior and the viscoelastic properties of these suspensions over a 4-week period. You can see the left graph shows the suspensions contain Avicel RC591 and the Cl611 consistently demonstrates the highest sextropic value, ideal for suspension applications. The two formulation contains xanthan gum, exhibit moderate sextropic property, and then sodium CMC suspension shows no sextropic response at 1% concentration. So the right graph displays 10 delta value, which reflects the balance between elastic and the viscous behavior. So the low 10 delta value of Avicel RC591 and the Cl611 suggests a more elastic, strong gel-like structure, which support excellent particle dispersion and ideal for maintaining suspension stability. The moderate 10 delta value of xanthan gum indicate a weak gel-like structure with moderate suspending capability. Then the very high 10 delta value of sodium CMC indicate more like a viscous dominant behavior. It's not a gel-like structure. So overall, this result confirms that the superior performance of Colloidal Avicel as a suspending agent. It provides both rheologic functionality and physical stability for liquid suspension formulations. This slide shows the turboscan stability index, also called TSI, of the suspensions after 4 weeks of storage. So the TSI provides a quantitative assessment of the physical stability of the suspensions. The lower the TSI is, the more stable the suspension is. So both suspensions that contains Colloidal Avicel grades like RC591 and Cl611 showed the lowest TSI, achieved the A+ rating, indicated excellent stability. Also, no phase separation was observed over the test period. The two suspensions used xanthan gum showed moderate TSI, rated C. Start to show phase separation at week 4. Then the sodium CMC-based suspension had very high TSI, rated D, with complete sedimentation of APAP within 1 week. So this result clearly shows that the superior suspending functionality of colloidal avicel, which is critical in maintaining uniformity and preventing sedimentation over time. So the suspension capability of colloidal avicel could be compromised in low pH environment. So in case study 2, a low pH ibuprofen model formulation was selected. The pH was around 2.7. The first two formulation contains only colloidal avicel as a suspending agent. The third formulation added xanthan gum as a protective colloidal. So the suspensions were characterized by a microscope study, rheological analysis, sedimentation monitor using turbo scan, and the stability test at room temperature was monitored for up to 1 month. This slide shows the overview characteristics of the suspension formulations, focusing on viscosity, particle size, and stability over time. The figure on the left, the data clearly shows that the suspensions contain Avicel RC591 exhibit significant lower viscosity compared to the other two formulations, which partially because of flocculation. In figure on the right, the D50 particle size of the RC591 suspension keep increasing over time, further suggesting progressive flocculation during storage. On the other hand, the formulation with Avicel CL611 showed good stability, maintained consistent viscosity and particle size across all time points. And then adding xanthan gum into the RC591 suspension, which is formulation 3, can effectively stabilize the formulation under low pH condition. So you can see stable D50, no flocculation, and overall very enhanced formulation robustness. So for low pH suspension, typically Avicel CL611 is a better choice than Avicel RC591. But if Avicel RC591 is selected, a protective colloidal like xanthan gum can effectively help to prevent flocculation and ensure a robust formulation. This slide shows suspension stability data measured by turboscan. So the formulation contain Avicel RC591 shows a high TSI value rated C, indicating instability and phase separation, which is visually also confirmed by the presence of a clear liquid layer in the sample bottle. And the suspension with Avicel CL611 demonstrate much better stability with TSI rating borderline between A and B. Then the addition of xanthan gum to the Avicel RC591 formulation can effectively address this instability of the RC591 suspension under low pH environment. Reduce the TSI significantly, actually reached A+ rating. So again, if RC591 is used for a low pH environment, a protective colloidal is needed to ensure its long-term stability. In case study 3, we focus on developing a stable APAP suspension in the presence of high salt concentrations. So the formulation pH is around 7. As shown in the table, the first column is a formulation without any salt. It was used as a base or control formulation. Then across column 2 to 4, it include formulations with different level of calcium chloride from 0.1% to 1% all the way to 1.5%. Then the last column shows a formulation with the highest calcium chloride concentration like 1.5, and then with added xanthan gum. The suspension characterization include pH measurement, like a microscope, rheological analysis, this sedimentation monitor through like turboscan. The stability study was monitored up to 1 month at room temperature. This slide highlights the impact of increasing salt concentration on the sextropic behavior and stability of Avicel RC591 based suspensions. The suspension without any added calcium chloride salt showed a typical sextropic curve. The blue curve in the figure on the left. However, as calcium chloride concentration increased from 0.5% to 1%, the suspension exhibit like reduced sextropic property. So you can see the bumpiness of the sextropic curve, which means flocculation and instability of the suspension after 4 weeks of storage. Also, due to the significant phase separation and flocculation, the suspension with 1.5% calcium chloride wasn't suitable for any rheology analysis. That's why the curve are not shown here in the figure on the left. Then the figure on the right shows the TSI values of the suspension during the stability study. The base RC591 formulation maintains a low TSI value, indicate stable suspension. As calcium chloride concentration increased, the TSI value kept increase, which means a decline in physical stability. Actually, at 1.5% calcium chloride concentration, the TSI exceeded 10, which means a really unstable suspension. So again, this data confirms that high salt environment really negatively affect both the structure and the stability of RC591 suspensions. Really need a formulation strategies to counteract stress. The photo on the left demonstrates the visual impact of high salt concentrations on the stability of Avicel RC591 suspensions. As salt content increase, a noticeable flocculation and phase separation occur, which means unstable suspension. However, as shown in the photo on the right, the addition of xanthan gum can effectively resolve these issues, restore the stability and preventing both flocculation and phase separation. So this highlights the critical role of protective colloidal, like xanthan gum, in maintaining suspension performance of Avicel RC591 under challenge ionic conditions. To summarize, colloidal Avicel is a very effective suspending agent, making it a top choice in developing patient-centric suspension formulations. It is very important to remember that the proper activation of colloidal Avicel is key to achieve its superior suspending capability. Also, please keep in mind that the stability of colloidal Avicel suspensions can be impacted by extreme low pH and high salt environment, which must be carefully managed during formulation. So overall, Colloidal Avicel offers a reliable foundation for designing effective and stable drug suspensions that tailor to patient needs. With that, I conclude my presentation, and I'm glad to answer questions that you may have. Thank you for your attention. Also, please reach out to ROCAT technical team for additional support that you may need.